the early warnings. Your heart is sending millions of people today live with a struggling heart and don't realize it. Heart failure rarely begins with a dramatic event. It settles in quietly, over time, in a body that adapts so well to imbalance that it stops recognizing its own distress signals. These warnings don't appear all at once. They blend into everyday life: fatigue, swelling, shortness of breath. But each one is your heart's way of asking for help. And the earlier you understand what your body is trying to tell you, the greater your chance of stopping the process before it becomes irreversible. 1. Loss of appetite and early fullness. Few people realize that the digestive system is one of the first to respond when the heart weakens. When the right side of the heart can't pump efficiently, blood begins to back up into the abdominal veins. This congestion increases pressure in the liver and intestines, making you feel bloated or full after just a few bites. It's not a digestive problem. It's circulatory. As blood flow slows, the stomach and liver receive less oxygen. Digestion slows down, metabolism drops, and the brain interprets that as, "I'm not hungry." In reality, the body is rationing energy. If you notice that you're eating less without trying, and your abdomen feels swollen or heavy, that is a warning sign. Track both your appetite and your body weight. Losing weight unintentionally while your belly feels tight or distended is a red flag for fluid overload linked to heart failure. 2. Rapid or irregular heartbeat. The heart is an electrical pump. When it senses that not enough blood is being delivered, it tries to compensate by beating faster. That's a short-term survival mechanism, but long-term, it backfires. A racing or irregular heartbeat means the heart-BS electrical rhythm is out of sync with its mechanical rhythm. It beats before its chambers are properly filled, so less blood is ejected each time. At first, this happens during stress, large meals, or mild exertion. Later, it becomes constant, even at rest. The danger is twofold. The heart works harder, while organs receive less oxygen. Monitoring your resting heart rate can literally save your life. If it stays above 90-100 beats per minute without a clear reason, especially if accompanied by fatigue or dizziness, it is time for a cardiac evaluation. 3. Trouble breathing when lying down. You lie down to sleep and suddenly feel like you can't catch your breath. That nighttime suffocation, called orthopnea, is a classic warning of fluid buildup. While standing, gravity keeps part of the excess fluid in your legs and abdomen. But when you lie flat, that fluid shifts back into circulation. If your heart can't handle the extra volume, it seeps into the lungs, causing tightness, coughing, and shortness of breath. Many people unconsciously adapt by stacking pillows or sleeping in a recliner, thinking it's just reflux or comfort. But what is really happening is pulmonary congestion at night, a silent sign that the heart is struggling against gravity. A simple but powerful clue. Pay attention to how many pillows you need to sleep comfortably. If that number is increasing, your heart may be asking for help. 4. Shortness of breath during the day. While orthopnea strikes at night, daytime breathlessness is its twin in motion. When the left ventricle, the heart's main pump, weakens, blood backs up into the lungs, air enters, but oxygen can't pass through as well because the air sacs are partly filled with fluid. It's like trying to breathe underwater. You inhale, but your tissues don't get enough oxygen. At first, it happens only on stairs or brisk walks. Later, even at rest. Many people blame this on aging or being out of shape, but that's exactly the kind of denial that delays diagnosis. Shortness of breath is your body asking for efficiency. And the way to regain it starts by reducing metabolic overload, cutting excess salt, avoiding processed foods, and increasing light, daily movement. Deep breathing exercises and gentle walking improve both oxygen delivery and cardiac rhythm. 5. Swollen abdomen. Abdominal swelling is one of the most visible signs that blood flow is backing up. When the right side of the heart can't send blood forward, it starts pooling in the abdominal veins. Eventually, fluid leaks into the space between organs, a condition known as ascites. This causes a firm, pressure-like bloating that's often mistaken for weight gain or digestive trouble. In reality, it's a reflection of right-sided heart failure, often triggered by earlier left-sided weakness. If your clothes suddenly feel tight around the waist but your weight hasn't changed much, or your belly feels tense and tender, seek evaluation. Treatment may include sodium restriction, fluid management, and medications to support circulation and liver function. 6. Persistent fatigue and weakness. The heart is the body's power supply. When it weakens, every cell feels the shortage. Blood carries oxygen, and oxygen creates energy. When circulation slows, the entire body shifts into low power mode. You wake up tired. Even small chores, showering, cooking, walking, feel exhausting. This isn't laziness or age, it's low tissue oxygenation. Muscles lose endurance, the brain slows, and energy production drops. The heart tries to compensate by beating faster, which only wastes more energy. If fatigue appears without a clear cause and worsens over time, don't ignore it. Early detection allows for reversal through simple habits, reducing sodium, controlling blood sugar, and adding gentle daily movement like short outdoor walks. Even swelling in legs and ankles. This is one of the most recognizable signs, peripheral edema. When the right side of the heart can't push blood forward efficiently, fluid starts pooling in the lower body. Gravity pulls it down. Feet, ankles, and legs become heavy and swollen by day's end. Socks leave deep marks, shoes feel tight, and your legs ache. This isn't just cosmetic. It's a visible marker of circulatory overload. In early stages, elevation helps. Later, even rest doesn't relieve it. At this point, it's crucial to cut sodium, avoid sitting too long, and, if prescribed, use mild diuretics. Movement, even light walking, helps drain excess fluid and improves venous return. 8. Poor tolerance to physical effort. Losing stamina is an early, and often ignored, warning. Climbing stairs, carrying groceries, or walking briskly becomes harder than it should be. That's because the heart's output is reduced. The muscles and lungs receive less oxygen, so the body reacts with shortness of breath and weakness. Instead of building endurance, most people start avoiding activity, which accelerates decline. Tracking your tolerance to daily tasks is one of the simplest ways to detect progression. If normal routines suddenly require more effort or frequent breaks, your circulation may be compromised. 9. Frequent nighttime urination. During the day, fluid builds up in your legs. At night, when you lie down, it returns to the bloodstream. The kidneys, flooded with this extra volume, go into overdrive, making you wake several times to urinate. This condition, called nocturia, is common in mid to late stages of heart failure. Many assume it's a urinary or prostate issue, but it's actually your kidneys responding to fluid redistribution. To ease this symptom, reduce evening fluid intake, elevate your legs before bed, and limit sodium throughout the day. These habits reduce overall retention and help restore balance overnight. 10. Persistent cough or wheezing. When the left side of the heart weakens, fluid builds up in the lungs. Some of that fluid leaks into the airways, triggering a chronic, dry cough, sometimes with frothy sputum or wheezing that mimics asthma. It's often worse when lying flat, as more fluid shifts toward the lungs. But unlike asthma, this isn't an airway problem. It's a pressure problem caused by blood backup. If a lingering cough or nighttime wheezing persists despite normal lung tests, ask your doctor to evaluate your heart. The solution lies in easing fluid overload and reducing blood pressure, not just inhalers. Sudden weight gain. Rapid weight gain, 4 to 10 pounds in a few days, isn't fat, it's fluid. When blood flow to the kidneys decreases, they mistake it for dehydration and start retaining water and sodium. That self-defense mechanism backfires. More fluid means more pressure on the heart. Monitoring your weight daily is one of the most effective ways to catch worsening heart failure early. If the scale jumps suddenly without a change in diet, alert your doctor. At home, simple habits make a big difference. Keep sodium intake under 2 grams per day, avoid processed foods, and eat potassium-rich options like avocado and leafy greens to balance fluid levels. The invisible cycle: heart, lungs, and kidneys. Heart failure rarely affects only the heart. It's a full-system feedback loop. The heart weakens, blood backs up, kidneys retain fluid, lungs fill, the heart weakens further. Breaking this cycle requires action on all three fronts: circulation, breathing, and elimination. That means control blood pressure, the heart's biggest enemy. Regulate blood sugar, high glucose damages arteries. Limit sodium and processed foods, they trigger retention and inflammation. Prioritize sleep. Deep rest is when your heart repairs. Move daily, not just to burn calories, but to keep blood flowing. The heart as the center of the body's circulation. The heart doesn't fail overnight. It sends warnings through breathing, rhythm, swelling, and fatigue. Each sign reflects a system struggling to balance itself. When pumping weakens, blood stagnates, lungs fill, the liver swells, and digestion slows. But here's the key. Heart failure is reversible in its early stages. Recognizing the signals early can save both heart function and quality of life. Sleep better. Control your weight, reduce salt, watch your breathing. Simple steps, powerful outcomes. Your heart doesn't need perfection, it needs attention. The human body is remarkably resilient. Even after years of strain, the heart can regain strength if you listen to it early enough. These symptoms aren't punishments, they're messages. Each cough, swelling, or restless night is your body's way of saying, "Help me before it's too late." Do the basics consistently, eat clean, move often, breathe deeply, and protect your sleep. Heart failure isn't just a malfunction of an organ. It is a mirror reflecting lifestyle and stress. And the moment you choose to care for it, it begins to care for you back.